Question 29. A girl weighs 12 kilograms. Calculate the required daily maintenance fluid volume using the Holiday-Seeger method. Option A, 1000 milliliters. Option B, 1100 milliliters. Option C, 1200 milliliters. Option D, 1500 milliliters. Using the Holiday-Seeger method, which recommends 100 milliliters/kg for the first 10 kilograms of body weight, and then 50 milliliters/kg for each subsequent kilogram. Total daily maintenance fluid volume equals 1000 milliliters plus 100 milliliters equals 1100 milliliters. Question 30. A 22-year-old woman with a history of anxiety visits the dentist for a routine cleaning. While in the waiting room, she suddenly starts complaining to the receptionist that is feeling extremely dizzy, weak, and experiencing blurred vision. The receptionist recognizes that she is having a panic attack. What is the most likely cause of the patient's symptoms? Option A, decreased cerebral blood flow. Option B, oxygen toxicity. Option C, carotid artery occlusion. The correct answer is option A, decreased cerebral blood flow. The release of stress hormones can lead to various effects on the body, such as increased heart rate, shallow breathing, and constriction of blood vessels. The constriction of blood vessels can potentially lead to decreased cerebral blood flow, which in turn can contribute to the signs and symptoms that the patient is experiencing. Question 31. At 38 weeks of gestational age, a pregnant woman presents with painful vaginal bleeding, uterine tenderness, and persistent fetal bradycardia were detected on CTG. What is the likely cause of these symptoms? Option A, cord prolapse. Option B, abruptio placenta. Option C, vasa previa. Most likely cause is option B, abruptio placenta. Abruptio placenta is a serious condition where the placenta prematurely separates from the uterine wall. This separation can lead to vaginal bleeding, uterine tenderness, decreased oxygen, and nutrients reaching the fetus, which can result in fetal distress and bradycardia on CTG. While cord prolapse and vasa previa are also potential causes of fetal distress and bradycardia, the combination of painful vaginal bleeding, uterine tenderness, and a history of placental separation is more indicative of abruptio placenta in this context. Question 32. Upon admission to the labor room, a patient was administered prostaglandin and subsequently experienced a significant amount of bleeding accompanied by a halt in uterine contractions. What is the likely reason for her current condition? Option A, placenta previa. Option B, uterine rupture. Option C, placenta abruption. Option D, hypersensitivity to prostaglandin. The likely cause of her condition is option B, uterine rupture. Uterine rupture is a serious obstetric emergency where the integrity of the uterine wall is compromised, often leading to massive bleeding. The administration of prostaglandin can induce or augment uterine contractions. And in cases of a weakened or compromised uterine wall, such as a scar from a previous C-section, excessive contractions can lead to uterine rupture. This can result in severe bleeding and fetal distress. Placenta previa is not directly related to uterine contractions. Placenta abruption does not involve uterine contractions. Prostaglandin hypersensitivity could potentially cause adverse reactions, but it is not a common cause of massive bleeding and uterine contraction cessation. Question 33. A 43-year-old female at 36 weeks of gestation, with a history of 4 pregnancies and 3 previous deliveries, presents for a follow-up appointment. The fundal height measures 36 centimeters, and the fetus is in cephalic presentation. The cervix is dilated 6 centimeters, and the fetal heart rate is 145 beats per minute. 5 minutes after the examination, her membranes rupture and suddenly the fetus develops bradycardia. What is the most crucial differential diagnosis to rule out? Option A, cord prolapse. Option B, abruptio placenta. Option C, uterine rupture. The correct answer is option A, cord prolapse. Cord prolapse can lead to compression or occlusion of the cord, resulting in decreased oxygen supply to the fetus and potentially causing bradycardia. The sudden onset of fetal bradycardia following membrane rupture raises concern for cord prolapse, as the cord can be pushed out along with the amniotic fluid. While abruptio placenta and uterine rupture can also cause fetal distress and bradycardia, the scenario is more suggestive of cord prolapse as the immediate concern. Question 34. A child presented in a well baby clinic, and the mother expressed concerns about exclusively breastfeeding her baby and the potential need for supplements. The doctor advised her that she could give the baby iron supplement starting next month. How old is the baby? Option A, 1 month. Option B, 3 months. Option C, 6 months. Option D, 8 months. The answer is option B, 3 months. Explanation. Exclusive breastfeeding is recommended for the first 6 months of life. However, around the age of 4 months, iron stores in a baby's body start to decrease, and there is a higher risk of iron deficiency anemia. Therefore, starting iron supplements around the age of 4 months is a common recommendation to ensure adequate iron intake.